Despite an individual's or practitioner's best laid efforts, there are a number of hurdles that can really compromise an individual's ability and consistency with respect to changing their behaviors that are associated with their weight. And I want to cover a few of these treatment hurdles, okay, from a clinical lens. So one of the things that can really impact us as a society, as a medical community, as a healthcare practitioner community, being able to properly manage obesity is the fact that a lot of people still dismiss obesity as a lifestyle choice. A lot of people still dismiss obesity as a lack of willpower, a lack of self-control, and really kind of individualize the fault here, that it's your fault for being obese, for instance. And what this does is it doesn't account for the complexity of obesity, and it doesn't account for the various factors that are promoting obesity in that particular person. Okay. Plus, it doesn't allow us to look at treatment options that account for the complexity of obesity, as well as the comorbidities that might be associated with it. Okay. So, yeah, like it says here, many people believe there is a cure for obesity, just simply lose the weight. Okay. But it's more complex than that. And we have to understand that obesity fundamentally changes the body, making it more difficult to keep that weight off, and making it more difficult for some people to lose the weight if that is in fact their goal. Okay. Something else that's going to be a hurdle to treatment is socioeconomic status. So socioeconomic status refers to a number of different factors, but kind of the big ones that we usually talk about are things like income, education, employment. And if individuals, let's say, have lower status with respect to income, etc., education, etc., that might negatively impact their ability to find treatment options or to stick with treatment options. So for instance, someone might, really, there's like this new gym that just came up near their house and they're so excited and they really want to use it, but it's financially prohibitive. It's too expensive. Someone has figured out that their appetite is the main issue, and they really want to control their appetite, but nothing else works, and they want to use a pharmacological intervention. It could be $200 a month, and they don't have that money. Okay, so individuals from lower income groups might have a harder time accessing the kind of care that they need, and of course that can impact their ability to manage obesity. Okay, time is the number one hurdle that we hear of when it comes to anything, pretty much. And time, like the time crunch, is a real thing. And for some people, they are just staying afloat. All their time is accounted for because all their time goes into just, keeping a roof over their head and food on the table. Okay. That said, one of the things that we might be able to work with respect to time and our clients is, shifting the perception around time, shifting from a perceived shortage of time to actually a realistic evaluation of our time and what we're spending our time on. So for instance, people tend to prioritize and spend time on the things that they have the most interest in. Okay, so can we shift, their valuation of certain things so they prioritize them more? Can we help that person, figure out where there's time leaks in their life? Sometimes there's nothing you can do about it, and we just have to be realistic about it and work with the time constraints there are. But sometimes people are spending time on things that they don't need to spend time on, and it's actually taking away from their overall well-being. Okay, but this is, again, a really individualized thing, and we have to realize that time is almost always going to come up for a limitation to, cooking and to exercising more, etc. Okay. Something also very real that's worth discussing is this concept of saboteurs. It's a really interesting thing that we see where, let's say there's two women and they're at about the same weight, and then one woman decides, I want to lose weight and I'm going to do these particular things. I'm going to start eating this way and exercising that way. Okay. And this other person has not made that decision. And now this person is changing their lifestyle. They're eating differently. They're bringing salads to work. They're going for walks after work, etc. This person might not like that. Why? It's hard to say, and that's not for me to figure out. Okay, but for some reason, this person might not like that this person's changing. Perhaps because that person wants this person to stay here. They don't want them to change because maybe they're afraid of losing them as a friend even. Okay. So this person might, bring extra donuts to work. Might, invite you to go for drinks after work, knowing that you usually go to exercise after work. They might do things, they might say things, they might just mess with you, even though you have the best intentions. And this can often happen with a person's spouse as well, where if one person's starting to change but the other person isn't, and that person's making super high caloric meals, that can really affect this person's ability to change. Okay? So it's important to realize these exist, and one of the things we could maybe help our clients with here, if we identify as this is a major barrier to treatment, is we can help them with their boundaries. We can help them with how to say no to things. We can help them with setting standards for their friendships and for the relationships. We can work on what do you say when this thing comes up? Because it's not just about willpower. Social influence is real and it's powerful. Right? And sometimes if people don't feel that they have a lot of power in a relationship, they might be really influenced by other people, or I'm very influenced by other people myself, even if I do feel powerful. So it's about figuring out how is that person going to feel that they are in control and that other people can influence them less. Okay? But these saboteurs are real, and it's worth identifying those. Something else worth mentioning that is a huge barrier to treatment as well is that sometimes, let's say someone is experiencing depression and they're put on medication for depression. Well, that medication for depression can sometimes actually promote weight gain. So they're trying to lose weight, they're trying to eat better, they're trying to exercise more, but this depression medication is sabotaging them. Okay, and so this book actually, I didn't list it out, but this book does actually list out a number of medications that can promote weight gain. And often with these medications, there's alternatives that don't have that side effect. Okay, so that's something to keep in mind. Is something that they're on actually promoting, body fat deposition, higher appetite, etc. Okay, so this whole section was really about realizing that interventions aren't easy. Things can come up. This is just a short list of what can potentially compromise treatment. But of course, we want to talk with our individuals. We want to figure out our individuals and see what is actually standing in their way. Okay, so in the next unit, I'm going to look at some more specific dietary and physical activity related foundational concepts with respect to weight management, and I will see you then.